Welcome to this session. I'm by name Kiden Robina and I'll be taking you through diabetes. So by the end of these sessions, you should be able to define diabetes and its types, explain the causes and the risk factors of diabetes, describe the symptoms and the complications of diabetes, discuss the diagnosis and the treatment of diabetes, then also identify the prevention and management strategies for diabetes. So when we talk about diabetes, mainly diabetes results from the lack of hormone, which we all know is known as insulin. And this is due to the fact that insulin, the body cells become insensitive to insulin, or the sensitivity is reduced, and as a result, the insulin will not be able to facilitate the uptake of the glucose into the tissues. So insulin is a hormone that is synthesized and secreted from the beta cells within the isolates of Langerhans in the pancreas. So this hormone is very essential for transferring glucose into the tissues. So when we eat food, food is digested, and the end products of digestion of our food, mainly the carbohydrates, the end products is glucose. So this glucose has to be taken into the body to make sure that it is used by the tissues to generate energy. And what facilitates that uptake, is the insulin. So in cases where the body cells have become insensitive to this insulin or less sensitive, there will be a lot of glucose circulating in the blood when it is not taken up by the tissues for its functions. So the mechanism of insulin and glucose: insulin decreases blood glucose levels by allowing glucose uptake into cells. So in diabetes, high blood glucose levels occur as glucose cannot enter the cells. Then this one triggers what is known as gluconeogenesis. So gluconeogenesis is where, instead of the glucose being generated by from carbohydrates being used by the body, because this glucose is now not taken up by the body tissues, the body is going to devise other means of creating its own glucose. And this normally can be from the proteins and the fats that are in the body. So because of the fact that this happens, you will realize that the person will end up with a lot of ketone bodies in the body, as we shall see as we continue in this. So gluconeogenesis normally actually takes place in the liver. So let's look at prevalence of diabetes. So according to the World Health Organization, more than 422 million people worldwide have diabetes, and this number is expected still to rise in the coming years. And this is related mainly to the fact that there's a lot of poor diet and the sedentary work. People do less exercises, and yet they consume a lot of carbohydrates that give yield to a lot of glucose, and this can end up causing that. So diabetes is a major cause of morbidity and mortality, as it increases the risk of cardiovascular diseases, kidney failure, blindness, amputation, and other complications. So all these complications can result from diabetes. So diabetes also imposes a significant economic burden on individuals, families, health systems, and societies. The global cost of diabetes was estimated at $1.3 trillion. That was in the year 2015, which accounts for around 1.8% of the global GDP. GDP stands for gross domestic uh, products. So types of diabetes. Uh, we have diabetes type 1. Type 1 is as a result of an autoimmune condition attacking pancreatic beta cells. So when the pancreatic beta cells are attacked by the immune system, when the immune system looks at the pancreatic, the beta cells in the pancreas as being foreign bodies, then they are attacked, they will be destroyed, and as a result, there will be less or no production of insulin. Then this condition can be diagnosed early in life, in years that are less than 40 years, and they can be treated only with insulin injections. Then we have type 2. This is due to insulin deficiency and the insulin resistance. So it can be type 2 is as a result of the insulin being produced in lesser amount, or the insulin is produced but the cells are resistant to it, so it cannot be taken up. So this one happens in 85 to 90% of drugs and the insulin. So previously, this kind of diabetes was known as uh, adult onset diabetes because it happens in people who are more than 40 years of age. But these days, it can emerge even earlier in life, and this is related mainly to poor diet. Then we have gestational diabetes. This one mainly occurs during pregnancy, and it can occur in 2 to 5% of pregnancies, and usually in second to third trimester. Can lead to complications like a high infant birth weight and the early labor. So this one increases the risk of type 2 diabetes in both mother and the baby later in life. Blood glucose levels need to be monitored closely post-birth to prevent spikes or drops of the glucose. So risky factors for this kind of diabetes include obesity and a family history of diabetes. Risky factors for diabetes include family history. If you have parents or siblings who have suffered from diabetes, it is very likely that you may end up suffering from diabetes. It may be type 1 or type 2. Then a race or ethnic background. People of African American, Asian American, Latino, Hispanic, American, Native American, or of Pacific Islander descent have a higher chance of developing diabetes than the other races. Then also age. The older the person grows, the higher the risk of the person developing diabetes. More so the type 2 diabetes, which frequently develops after uh, the age of 40. The other risky factor is gestational diabetes. The other, yeah, gestational diabetes, which happens during pregnancy. So when the person uh, produces a baby who is close to 4 kilograms or more, there are chances that the person later in life may end up developing diabetes. Then weight, overweight people may end up also developing diabetes. Then physical activity, people who are inactive most of the time, doing sedentary work, can end up developing diabetes. So it is advised that one should exercise at least 3 times a week. Then blood pressure. Individuals who suffer from high blood pressure can also end up developing diabetes. Then pre-diabetes. Pre-diabetes is a period where the person has impaired glucose tolerance or impaired fasting glucose increases the risk of, and this increases the risk of developing diabetes. This is a period that happens before the person develops diabetes, but the person starts having some signs like he's having diabetes. She has um, glucose intolerance. She cannot tolerate glucose for long. When the glucose is measured, it is slightly higher than normal, but the other signs and symptoms of diabetes are not present. This is what is called the pre-diabetes. So symptoms of diabetes include the following. There's increased thirst and frequent urination. The person always has that urge of taking a lot of water. Why? Because there's a lot of glucose that is in blood. So there is high concentration of the blood, and as a result, it signals that the person has to take a lot of water. And once the person takes a lot of water, the person will end up also urinating frequently. Then feeling tired or ill, inability to utilize carbohydrates in the body can lead to this issue of the person feeling tired and ill all the time, is feeling sickly all the time. Skin, blood, or bladder infections. Now, because of the too much glucose in the blood, there will be a frequent growth of the bacteria, because the bacteria will have enough glucose to feed on, and as a result, the person will end up with a lot of infections in the blood, infections on the skin, and also in the bladder. Unexpected weight loss. So the infections in the bladder is because as the urine is being formed, since there is a lot of glucose in the blood, some of the glucose will leak into the urine, and when it stays in the bladder for some time, the microorganisms will feed on it, then they will multiply, and hence bringing infections of the bladder. Then the other symptom is unexpected weight gain. Not absorbed by the body for use by the tissues. So as a result, the person will lose a lot of weight. There is normally slow healing of cuts and bruises, and in some people, this is actually what will be seen. It is what will signal that likely this person is having diabetes. The person gets a small cut, but the cut cannot heal. It takes long. So high sugar narrows arteries, reducing blood flow and oxygen. So as a result, the wound will not be getting enough blood and also enough oxygen, so it takes long to heal. There's also dry, itchy skin, poor circulation due to narrowed arteries, and that leads to this dry and itchy skin. Diagnostic tests in diabetes. We have the A1C. So this is a blood test that measures the average blood glucose level for the past 2 to 3 months. It shows how well a person's diabetes is being controlled. So diabetes is diagnosed at an A1C of greater than or equal to 6.5%. That is, if it is tested and it is equal to 6.5% or more, then it means the person is diabetic. Then another test is fasting plasma glucose, FPG. This is a blood test that measures the blood glucose level after not eating or drinking anything except water for at least 8 hours. So the person fasts for at least 8 hours without taking anything, including water. And there, the blood can be tested. So For those people who have diabetes, if their blood is tested, it will give results of equivalent to 126 milligrams per deciliter or more. That means that the person has diabetes. Then another one is the oral glucose tolerance test, or OGTT. So this is a 2-hour test that measures the blood glucose level before and 2 hours after drinking a special sweet drink. So it shows how the body processes sugar. Diabetes is diagnosed at 2-hour blood glucose of greater than or equal to 200 milligrams per deciliter. So the person is checked before being glucose. After 2 hours will be tested. So if she
Typing. Where is Sam?
is 200 milligrams per deciliter, it means the person is diabetic. The other test is the random plasma glucose test. So the random plasma glucose test is a kind of blood test that measures the blood glucose level at any time of the day when a person has severe diabetes symptoms. So this one does not require any fasting, does not require the giving of the oral glucose, then you wait for 2 hours. For it is done at any time. And this is done in cases when the person is severely sick. So, diabetes is diagnosed at a blood glucose of greater than or equal to 200 milligrams per deciliter in a random plasma glucose test. Prediabetes. Prediabetes refers to a condition where the blood glucose level is higher than normal
You type your thing Z. You
diabetes.
just
So it is slightly higher than normal, but it is not so high that we can diagnose it as diabetes. So this is what is called the pre-diabetes. It increases the risk of developing type 2 diabetes and cardiovascular disease. Pre-diabetes is diagnosed by an A1C of 5.7 or to 6.4%. Remember we said that the AIC is a diagnostic test for diabetes, and if it reads equivalence of 6.5% or more, it means the person is diabetic. So if it is between 5.7 to 6.4%, then it means that the person is in pre-diabetes. Um, so it can be done through that, can also be tested through fasting blood sugar. So when the fasting blood sugar reads 100 to 125 milligrams per deciliter, it means the person is in pre-diabetes. Remember we said when the person is diabetic, it will be equivalent or more than 126. Then the oral glucose tolerance test, which is done 2 hours after the person has been given oral glucose, can read between 140 to 199 milligrams per deciliter. If it reads 200 milligrams per deciliter, it means that this person is diabetic. So if it is between in this range, it means that the person is in pre-diabetes. So diagnosis of diabetes, we have fasting glucose concentration. This is still a continuation. Fasting glucose concentration. So the person fasts for 12 hours prior to test and measure glucose levels. So if the glucose levels for a person who is diabetic, if the glucose levels read 7.0 millimoles per liter, it means that the person is diabetic. It is 7.0, it means the person is than 6 millimoles per liter, the person is considered to be normal. Impaired glucose tolerance test. Here, oral glucose tolerance test, glucose levels fail to return to normal after 2 hours of the person being given glucose, oral glucose. Then the urine test, presence of glucose in the urine, which we refer to as glycosuria. If it is more than 180 milligrams per deciliter, it's considered to be diabetic. So which criteria do we use? So according to WHO 2006, for diabetes, we follow these criteria before we diagnose someone having diabetes. Fasting plasma sugar of equal or less or greater than 7 millimoles per liter or 126 milligrams per deciliter. Then 2-hour plasma glucose, which is equal or less than 11.1 millimoles per liter, in brackets 200 milligrams per deciliter. Then impaired glucose tolerance test. Here we consider if the fasting plasma glucose is less than 7 millimoles per liter or 126 milligrams per deciliter. Then the 2-hour plasma glucose, which is equal or greater than 7.8 and equal or less than 11.1 millimoles per deciliter. In brackets, 140 milligrams per deciliter and 200 milligrams per deciliter. Then let us look at glycosylated hemoglobin. So this one is not used for diagnostic purposes, but it is a very important test that is also done when the person is diabetic. It reflects the blood glucose control over 2 to 3 months period. So in people who are non-diabetic, the glycosylated hemoglobin will be 4 to 6%. For those who are diabetic, the glycosylated hemoglobin will be 6.5 to 7%. So levels above 7% indicate chronic or uncontrolled diabetes. So glycosylated hemoglobin is a hemoglobin which has glucose attached to it. So in our normal blood, if the glucose that is attached to the hemoglobin in our blood is 4 to 6%, it is considered to be normal. But if it reaches to 6.5 to 7%, then that is diabetic desirable. Then if it is more than 7%, it indicates that the diabetes is a chronic one and it has been uncontrolled, has not been controlled well. Let us look at blood plasma levels or the fasting level. So ideal range is 4 to 7 millimoles per liter. It can be considered low if it is less than 4 millimoles per liter. In this case, the person is hypoglycemic, or the person is going into hypoglycemia. Then in normal cases, 2 hours after meals, the blood plasma levels will test 5 to 10 millimoles per liter. In abnormal cases, if it is considered to be high, if the millimoles are greater than 10 per liter, then this is considered to be hyperglycemia. So less than 4 millimoles per liter indicates diabetic coma. Let's look at diabetic complications. One is energy source shift, because the glucose cannot be absorbed into the tissues. the body will result into getting the glucose from the other sources, that is the proteins and the fats, which also has its own complication, as we shall see when we continue. Then cells turn to fat and protein for energy, that I have mentioned. So the fat metabolism leads to what is called the ketosis and the acidosis. Ketosis refers to the buildup of ketone bodies in the body. Then acidosis refers to the high acidity of the blood, and this all results from fat metabolism. Another complication is cardiovascular damage. Arterial narrowing and hardening increase blood pressure. So that is the reason why when someone is diagnosed with diabetes, it will not be long. Soon, the person will also be diagnosed with hypertension. Then, reduced oxygen delivery will occur as a result of the arterial narrowing and hardening of the arteries. Another complication is diabetic ketoacidosis, or what can be known as DKA. High ketone levels cause blood acidity, which results in a thirst and frequent urination. This I have mentioned before. Fruity breath odor, the person breathes something that's sweet to someone who is close to him or her. Blurry vision, the person will not be able to see properly. Then the person can end up with confusion. Then muscle protein as the energy source. So because of the fact that the body cannot take in glucose, it can end up also not only metabolizing the fats, but can also end up metabolizing the muscle protein. So protein drawn from muscles can lead to muscle wasting. The person ends up losing a lot of weight, and this explains the reason why diabetic patients, when they before or when they have just been um, diagnosed, they lose a lot of weight. So sarcopenia. This also leads to weakness of the body. The other complication is kidney disease, because there will be a lot of toxins, and this can end up affecting the kidneys, because the kidneys are the ones that are important for formation of the urine. So as it tries to filter, there are a lot of glucose that needs to be filtered, then they end up becoming damaged. Nephropathy, there will be reduced blood supply, filtration, and excretion rates, which is referred to as nephropathy. Then a damaged filter allows protein leakage into the urine. So when the urine is tested for proteins, it will read positive. Then nerve damage or neuropathy. So that is the reason why diabetic patients end up getting injuries more so on their feet. Why? Because their nerves around those areas end up becoming insensitive. They die off. They become damaged, so they cannot feel anything cold. They cannot feel anything hot. They cannot feel anything sharp. So this is the challenge. High blood glucose damages nerve fibers, altering sensations. There will also be eye damage, which leads to the blurring of the vision. And this is because retinal damage can be experienced due to high blood glucose levels. Then there is also hypoglycemia, which is the low levels of glucose in the body. There another complication is hypertension. So, hypertension is the presence of high blood pressure, which can lead to hypertension. So, hypertension can lead to hyperglycemia, which is the low blood sugar level. Then, another complication is diabetes. So, diabetes to exercise, or the person is prescribed the insulin. After the insulin injection, the insulin may end up being too much in the body, and much of the glucose is being taken into the tissues, and as a result, the person ends up with low blood glucose, which is known as hypoglycemia. Then can lead to diabetic coma, can lead to amputations, more so in cases of injuries that has happened to the limbs and cannot heal, can lead to amputation. Then diabetes related non-traumatic lower limb amputations due to poor circulation. This I've already explained. Persistent infections can also lead to sepsis. There's also kidney failure. Then diabetes contributes to many cases of of kidney failure. Let's look at diabetic ketoacidosis, or what is known as DKA. This is a complication of diabetes that is characterized by high blood glucose levels, or known as hyperglycemia, high levels of ketone bodies in the plasma, or known as the ketosis, and the metabolic acidosis. So the causes of this can be the most common in individuals with it is the most common in individuals with the type 1 diabetes mellitus, which we can also abbreviate as DM. So this can occur due to insulin deficiency, absolute or result or relative, triggered by physiological stressors such as acute infections, myocardial infection, or certain medications. So what are the clinical manifestation of diabetic ketoacidosis? One is nausea and vomiting, abdominal pain. Then the other one is potential progression to cerebral edema, coma, or death if it is unattended to. The treatment of diabetic ketoacidosis. One is fluid and electrolyte replacement. So the patient will require intravenous fluids that can be administered immediately to restore intravascular volume and ensure kidney perfusion. Then monitor for hypokalemia or low potassium levels and replace potassium as needed. The second treatment is insulin administration. So administer regular insulin such as insulin detamir or insulin glargine initially through IV bolus followed by continuous IV infusion. Monitor blood sugar levels regularly and adjust insulin doses accordingly. The third one is transition to subcutaneous insulin. So transition the patient to subcutaneous insulin, which is the regular insulin, when their condition improves. So the first two treatments are meant to stabilize the patient. When the patient stabilizes, then we can transfer the patient to the subcutaneous insulin. The subcutaneous insulin, the patient can even be taught on how he can administer it himself, so it does not need infusion. Then initiate a typical split mixture or basobolus insulin regimen. Prevention of hypokalemia. Hypokalemia refers to low potassium levels in the blood. So how do we prevent it? We prevent it through monitoring the potassium levels closely during treatment. Then you replace potassium alongside intravenous fluids to prevent hypokalemia. Then also check potassium levels every 1 to 2 hours in the initial stages of treatment to make sure that as you are treating for the diabetes, you don't end up again going into hypokalemia. The nursing considerations. We consider treatment should ideally be provided in high dependency settings. That's why you find such patients with diabetes in most cases are monitored in the ICU because they require close monitoring. So the signs and symptoms are monitored closely, and also the laboratory assessments are carried out frequently to make sure that they are in a stable state. Then monitor blood glucose levels, electrolyte levels, and vital signs regularly. Educate patients on disease management, including insulin administration, dietary considerations, and recognitions of signs of diabetic ketoacidosis to make sure that the patient can be able to manage himself even if the nurse is far. Then managing blood glucose levels. Here we make sure that the drug or insulin therapy is maintained based on the prescription. To the exact time that was prescribed. For instance, the insulin cannot be given unless food is ready, unless the person is going to eat. That is when it can be given. Then dietary management. The food of someone with diabetes should be more of fruits and vegetables. So should have actually less carbohydrates because carbohydrates is the major problem here. Then physical activity, the patient is encouraged to do a lot of physical activity to make sure that he burns down most of the fats and make sure that his body can improve in terms of insulin production. So how do we manage the blood glucose levels? We continue managing by maintaining a healthy weight and avoid obesity. Eat a balanced diet that is low in sugar, salt, and fat. Exercise regularly and stay physically active. Monitor blood glucose levels and take medication as prescribed. Then, if the person was smoking or taking alcohol, the person should quit those habits to make sure that they can be able to adjust his life well. Then also manage stress and practice relaxation techniques. So that is all for today. Thank you so much for being part of this, and may God bless you.